This program is not a substitute for hands-on training, but we will go over some techniques and guidelines that will help you have a better understanding of what to do when an emergency occurs. Knowing how to use AED or perform CPR can save someone's life. Pay close attention to what we are about to go over so you can potentially be the hero when the unexpected happens. What does AED stand for? An AED, or Automated External Defibrillator, is used to help those experiencing sudden cardiac arrest. It's a sophisticated yet easy-to-use medical device that can analyze the heart's rhythm and, if necessary, deliver an electrical shock or defibrillation to help the heart reestablish an effective rhythm. What does CPR stand for? CPR is short for cardiopulmonary resuscitation. This is an emergency life-saving procedure performed when the heart stops beating. Immediate CPR can double or even triple chances of survival after cardiac arrest. Keeping the blood flow active, even partially, extends the opportunity for a successful resuscitation once trained medical staff arrive on site. No one can foresee a medical emergency, but when you are the only person around, you can be the determining factor in saving their life. When someone's heart stops, brain damage can occur in as little as 4 minutes if the proper steps are not taken to resuscitate that person. The first step is to call 911. Making sure help is on the way is key for that person's survival. Even if you know how to use an AED, you might not have one nearby. Making sure professional medical help is on the way ensures that the right equipment will be on site shortly. After calling 911, begin CPR immediately. If there is someone else with you other than the person experiencing cardiac arrest, have them call 911 so you can begin performing CPR immediately. If there is an AED nearby, grab that device immediately. If not, begin CPR until help arrives. First, determine if they are conscious and breathing. If it does not look like they are breathing, first open the airway. With the person lying on his or her back, tilt the head back slightly to lift the chin. Check for breathing. Listen carefully for no more than 10 seconds for sounds of breathing. Occasional gasping sounds do not equate to breathing. If there is no breathing, begin CPR. Make sure your hands are in the correct position before beginning chest compressions. Place the bottom palm over the center of the patient's chest, on the lower part of the sternum. Do not press on the lower tip of the sternum. This is called the xiphoid. If your hand is positioned too low, you can damage their liver. Now that we know the proper position, next put your other hand on top of the hand on the chest. Interlock your fingers to keep compressions focused where they need to be. Compress straight down with enough pressure to compress about 2 inches. Push hard, push fast. Place your hands one on top of the other in the middle of the chest. Use your body weight to help you administer compressions that are at least 2 inches deep and delivered at a rate of at least 100 compressions per minute. Deliver rescue breaths. With the person's head tilted back slightly and the chin lifted, pinch the nose shut and place your mouth over the person's mouth to make a complete seal. Blow into the person's mouth to make the chest rise. Deliver 2 rescue breaths, then continue compressions. If the chest does not rise with the initial rescue breath, retilt the head before delivering the second breath. If the chest doesn't rise with the second breath, the person may be choking. After each subsequent set of 30 chest compressions and before attempting breaths, look for an object and, if seen, remove it. Continue CPR steps. Keep performing cycles of chest compressions and breathing until the person exhibits signs of life, such as breathing, an AED becomes available, or EMS or trained medical responder arrives on scene. Be aware of your surroundings. Make sure you are in a safe setting while performing CPR. Monitor your own well-being during this and don't put yourself in a dangerous situation due to exhaustion. rescue breathing has become one of the most controversial steps in CPR. The debate is ongoing about how much is enough or too much and whether it's even necessary. For healthcare providers and those trained, conventional CPR using chest compressions and mouth-to-mouth breathing at a ratio of 30:2 compressions to breaths. In adult victims of cardiac arrest, it is reasonable for rescuers to perform chest compressions at a rate of 100 to 120 per minute and to a depth of at least 2 inches for the average adult, while avoiding excessive chest compression depths greater than 2.4 inches. For the general public or bystanders who witness an adult suddenly collapse, compression-only CPR or hands-only CPR. Hands-only CPR is CPR without mouth-to-mouth breaths. It is recommended for use by people who see a teen or adult suddenly collapse in an out-of-hospital setting, such as home, at work, or in a park. There are 5 critical components to remember when performing CPR. 1. Minimize interruptions in chest compressions. 2. Provide compressions of adequate rate and depth. 3. Avoid leaning on the victim between compressions. 4. Ensure proper hand placement. 5. Avoid excessive ventilation. Even children can perform successful CPR. A recent study tested 6th graders and their capacity to use hands-only CPR to save lives. The study found that the majority of children could perform CPR in the correct location and at the appropriate compression rate, making this a viable group to train to help save lives. According to a study released by the Resuscitation Science Symposium, men are more likely to receive bystander CPR in public locations compared to women. Women and men receive similar CPR assistance within the home, but in public, 45% of men received assistance compared to only 39% of women. Men were 1.23 times more likely to receive bystander CPR in public, and their chance of survival was 23% higher compared to women. So why the discrepancy? It could come down to anatomy and a bystander being comfortable enough to perform CPR on a woman. Do not hesitate to help anyone in need, even if you are male and the person you are helping is female. When it comes to saving someone's life, they'll be glad you did. Next, let's talk about AEDs. Again, an AED, or Automated External Defibrillator, is used to help those experiencing sudden cardiac arrest. Sudden cardiac arrest is among the leading causes of death in the United States. In fact, more than 350,000 people will suffer a cardiac arrest this year. Currently, the only way to restore a regular heart rhythm during cardiac arrest is to use an AED. Of course, you can and should request the assistance of trained medical professionals. However, because the average response time for first responders once 911 is called is 8 to 12 minutes, and for each minute defibrillation is delayed, the odds of survival are reduced by approximately 10%. Having access to an AED and knowing how to use one is critical. These AED steps should be used when caring for a non-breathing child age 8 or older who weighs more than 55 pounds, or an adult. After checking the scene and ensuring that the person needs help, you should ask a bystander to call 911 for help. Then turn on the AED and follow the visual and/or audio prompts. Open the person's shirt and wipe his or her bare chest dry. If the person is wearing any medication patches, you should use a gloved, if possible, hand to remove the patches before wiping the person's chest. Attach AED pads and plug in the connector if necessary. Make sure no one, including you, is touching the person. Tell everyone to stand clear. Push the Analyze button if necessary, and allow the AED to analyze the person's heart rhythm. If the AED recommends that you deliver a shock to the person, make sure that no one, including you, is touching the person, and tell everyone to stand clear. Once clear, press the shock button. Begin CPR after delivering the shock. Or, if no shock is advised, begin CPR. Perform 2 minutes, about 5 cycles of CPR, and continue to follow AED's prompts. If you notice obvious signs of life, discontinue CPR and monitor breathing for any changes in condition. Features may vary slightly. Make sure you are trained on the specific AED you're going to be using. Knowing what to do is key, and your reaction time is vital. We covered a lot in this video, but this does not substitute for good hands-on training by a certified professional. Continue your training and revisit this video as needed. We thank you for taking the time to make the world a safer place. Have a great day.